بسم الله الرحمن الرحيم. في وحدة جديدة ومختصرة نتحدث عن التغذية العلاجية لأمراض الكبد Medical Nutrition Therapy on Liver Diseases. هذه المحاضرة موجهة لطالبات وطلاب المستوى الثالث قسم التغذية السريرية بجامعة الأزهر ضمن مادة التغذية العلاجية. استكمالا للحديث عن أمراض الجهاز الهضمي، نوضح في هذه المحاضرة بعض الأمراض للأعضاء التكميلية والوظيفية المصاحبة للجهاز الهضمي، وهي بالخصوص الكبد والبنكرياس، لكن في هذه الوحدة فقط الحديث عن أمراض الكبد. سوف نتحدث في هذه الوحدة عن 5 محاور لأمراض مختلفة خاصة بالكبد. كمقدمة، الكبد هو أكبر عضو في جسم الإنسان، حيث يسمى بمصنع التمثيل الغذائي، وهو يشمل وظائف مختلفة منها taking up, storing and processing nutrients from foods including fat, sugar and protein and delivering them to the rest of the body when needed, making new proteins such as clotting factors and immune factors, producing bile which helps the body absorb fats, cholesterols and fat-soluble vitamins, removing waste products the kidney cannot remove such as fat, cholesterol, toxin and medications. المحور الأول Non-Alcoholic Fatty Liver Disease، مرض الكبد الدهني غير الكحولي. Definition and facts. Non-alcoholic fatty liver disease is a condition in which excess fat is stored in liver. This buildup of fat is not caused by heavy alcohol use، أي أنها غير ناتجة عن استعمال الكحول. Two types of non-alcoholic fatty liver disease are simple fatty liver and non-alcoholic steatohepatitis. Simple fatty liver and non-alcoholic steatohepatitis are two separate conditions. The simple fatty liver, also called non-alcoholic fatty liver, is a form of non-alcoholic fatty liver disease in which fat accumulated in liver but little or no inflammation or liver cell damage. بمعنى أن هنالك تراكم للدهون على الكبد ولكن ليس هنالك التهاب وليس هنالك تلف في خلايا الكبد. Non-alcoholic steatohepatitis is a form of non-alcoholic fatty liver disease in which patient has hepatitis and liver cell damage, in addition to fat and cell in liver, which can cause fibrosis. Non-alcoholic steatohepatitis may lead to cirrhosis or liver cancer. Causes of non-alcoholic fatty liver disease. People are more likely to develop non-alcoholic fatty liver disease, either simple or the steatohepatitis, if they are overweight or obese or have insulin resistance, having abnormal level of fat in the blood, which may include increased triglyceride, increased total cholesterol, increased low density lipoproteins and decreased high density lipoprotein cholesterol. Having metabolic syndrome, which is a group of traits and medical conditions linked to overweight and obesity. Doctor defines metabolic syndrome as the presence of any of 3 of the following: large waist size, high level of triglyceride, low levels of HDL, high blood pressure, higher than normal blood glucose level. إذا اجتمعت 3 من هذه العوامل ال5 فإن ذلك يعني أن المريض لديه metabolic syndrome. Having type 2 diabetes is one of causes that lead to non-alcoholic fatty liver disease. Experts still studying the genes that may play a role in non-alcoholic fatty liver disease. Treatment. Doctors recommend weight loss to treat non-alcoholic fatty liver disease and non-alcoholic steatohepatitis. Weight loss can reduce fat in the liver, inflammation and fibrosis or scarring. إذن خفض الوزن هو الحل المثالي لمعالجة non-alcoholic fatty liver disease. التوصيات العلمية تؤكد أن خفض 5% من وزن الجسم سوف يقلل من تراكم الدهون على الكبد، وأن خفض 10% من وزن الجسم سوف يقلل من تراكم الدهون ويقلل من معدل الالتهاب في الكبد. لكن خفض الوزن يجب أن يكون تدريجيا وبطيئا على مدار عام كامل، لأن خفض الوزن السريع سوف يؤدي إلى جعل تراكم الدهون أسوأ على الكبد. Nutrition for non-alcoholic fatty liver disease. Limiting intake of fats to help prevent or treat non-alcoholic fatty liver disease and steatohepatitis. There are 4 types of fat. They are saturated fats, trans fats, monounsaturated fats, and polyunsaturated fats. توجد 4 أنواع من الدهون يجب خفضها بالكامل دون استثناء سواء كانت صحية أو غير صحية. وإن كان لابد فيجب المحافظة على العوامل الصحية من الدهون مثل البوليانساتوريتد فاتي أسيد وبالأخص الأوميجا 3 فاتي أسيد والأوميجا 9 مونوانساتوريتد فاتي أسيد مثل زيت الزيتون. خفض الدهون يجب أن يشمل اختيار الأغذية بعناية والاتجاه أكثر للأغذية قليلة الدهون. Replacing saturated fat and trans fat in the liver with monounsaturated fats and polyunsaturated fats, especially omega-3 fatty acid, may reduce the chance of heart disease if having non-alcoholic fatty liver disease. اختيار الأغذية التي تحتوي على أوميجا 3 وليس أوميجا 6 يعتبر مهم جدا، حيث أن أوميجا 6 تزيد معدل الالتهاب مقارنة بغيرها من الدهون. Eating more low glycemic index foods such as most fruits and vegetables and whole grains. These foods affect blood glucose less than high glycemic index such as white bread, white rice, and potatoes. Avoid foods and drinks that contain large amount simple sugars, especially fructose. Avoid heavy alcohol use which can damage the liver. في المحور الثاني نتحدث عن liver cirrhosis. Cirrhosis is a condition in which liver slowly deteriorates and is unable to function normally due to chronic or long-lasting injury. Scar tissue replaces healthy liver tissue and partially blocks the flow of blood through the liver. إذا هنا تتغير الطبيعة الخلوية لخلايا الكبد وتتوقف تدفق الدم داخل الكبد. The liver can regenerate most of its own cells when they become damaged. However, if the injury to the liver is too severe or long-lasting, regeneration is incomplete and the liver creates scar tissue. Scarring of the liver, also called fibrosis, may lead to cirrhosis. Progressing nature of cirrhosis. The buildup of scar tissue that causes cirrhosis is usually a slow and gradual process. In the early stages of cirrhosis, the liver continues to function. However, as a cirrhosis gets worse and the scar tissue replaces more healthy tissue, the liver will begin to fail. تكون خلايا سكار والتي سوف تؤدي إلى تلف خلايا الكبد وتحل محلها يمر ببطء وبفترة زمنية طويلة. في المراحل الأولى يستمر الكبد بالعمل، لكن حينما تمتد تكون السكار تيشو بدلاً من خلايا الكبد تبدأ وظائف الكبد في الفشل. Chronic liver, which is also called end-stage liver disease, progresses over months, years, or even decades. With end-stage liver disease, the liver can no longer perform important function or effectively replace damaged tissue. الأسباب التي تؤدي إلى ظهور السيروسيس. يوجد مجموعتين من الأسباب. المجموعة الأولى major causes chronic hepatitis C or B, alcoholic related liver disease, non-alcoholic fatty liver disease, and steatohepatitis. المجموعة الثانية less common causes autoimmune hepatitis, primary biliary cirrhosis, cystic fibrosis, Wilson disease, hemochromatosis. هذه الأمراض أقل احتمالية لأن تحول خلايا الكبد السليمة إلى سكار فتؤدي إلى سيروسيس، ولكن وجودها يزيد احتمالية التغيرات المرضية. Signs and symptoms of cirrhosis: fatigue or feeling tired, weakness, itching, loss of appetite, weight loss, nausea, bloating of the abdomen from the ascites, انتفاخ البطن نتيجة تراكم السوائل في جدار البطن، edema, swelling due to build-up of fluid, spider-like blood vessels, jaundice, a condition that causes the skin and whites of the eye to turn zero هو اصفرار الجسم. Complications of cirrhosis. Cirrhosis may lead to portal hypertension, edema, ascites, and splenomegaly. ممكن أن تؤدي إلى تضخم الطحال وتراكم السوائل في الأطراف وفي البطن وارتفاع في ضغط الشريان البابي. Varices, portal hypertension may cause enlarged blood vessels in the esophagus, stomach or both. أيضا ممكن أن تؤدي إلى تضخم في الأوعية الدموية في المريء أو المعدة أو كليهما. Hepatic encephalopathy, a failing liver cannot remove toxin from the blood, so they eventually accumulate in the brain. This condition can decrease mental function and cause stupor and even coma. ممكن أن تؤدي إلى غياب عن الوعي نتيجة لتراكم السموم في الدم. Signs of decreased mental function including confusion, personality change, memory loss, trouble concentrating, and a change in sleep habits. How is cirrhosis treated? A treatment for cirrhosis depends on the cause of the disease and whether complications are present. إذن تعتمد على الأسباب التي أدت إلى حدوث السيروسيس وأيضا على وجود المضاعفات. In the early stages of cirrhosis, the goal of treatment are to slow the progression of tissue scarring in the liver and prevent the complications. As cirrhosis progresses, person may need additional treatment and hospitalization to manage the complication. The treatment may include the following: treating the causes of cirrhosis, treating symptoms and complication of the cirrhosis. إذن العلاج يجب أن يشمل أمرين. الأمر الأول هو أن يشمل الأسباب التي أدت إلى حدوث السيروسيس وأيضا معالجة الظواهر السيمتومز والمضاعفات التي نتجت عن السيروسيس. Eating diet and nutrition for cirrhosis. A healthy diet is important in all stages of cirrhosis because malnutrition is common in diseased people. Cirrhosis may lead to malnutrition because it can cause people to eat less because symptoms such as loss of appetite, change in the metabolism, reduced absorption of vitamins and minerals. Healthcare providers can recommend a meal plan that is well balanced and provides enough calories and protein. A sodium restricted diet recommended in case of ascites. في حال تراكم السوائل في البطن فيجب التوقف عن تناول الأغذية الغنية بالصوديوم. To improve nutrition, liquid supplements could be used via enteral or parenteral feeding. A person with cirrhosis should not eat raw shellfish which can contain a bacterium that cause a serious infection. يجب أن يتم متابعة الأعراض الجانبية ومعالجتها نتيجة ضعف الامتصاص ومنها calcium and vitamin D supplements to help prevent osteoporosis. المحور الثالث من هذه المحاضرة primary sclerosing cholangitis. Definition and facts of primary sclerosing cholangitis. Primary sclerosing cholangitis is a chronic disease in which the bile ducts inside and outside the liver become inflamed and scarred and are eventually narrowed or blocked. When the bile ducts are narrowed or blocked, bile builds up in the liver and cause liver damage. القنوات المرارية داخل الكبد أو خارجه سوف يحدث بها التهاب وسكار وبعد ذلك تضيق ويحدث بها انسداد يؤدي إلى تراكم العصارة الصفراء في الكبد يؤدي إلى تلف خلايا الكبد. This damage can lead to cirrhosis and eventually liver failure. Medical experts believe that primary sclerosing cholangitis is an autoimmune disease, which means that the immune system is overactive and attacks normal healthy bile duct cells. Risk factors for primary sclerosing cholangitis. People who are between the ages of 30 to 5 are a man having inflammatory bowel disease, most commonly ulcerative colitis, have a family member who have primary sclerosing cholangitis. إذن هذه هي عوامل الخطر التي تزيد احتمالية الإصابة في البرايمري سكليروزين cholangitis. أن يكون بعمر ما بين 30 إلى 50، أن يكون ميل، وأيضا لديه التهابات مسبقة في الجهاز الهضمي. Complications of primary sclerosing cholangitis: low level of fat-soluble vitamin, bile duct infection, cirrhosis, liver failure, bile duct cancer, gallbladder cancer. The treatment for primary sclerosing cholangitis: doctors can't cure this disease or keep the disease from getting worse. However, they can treat narrowed or blocked bile disease and the symptoms and the complications of this disease. Narrowed or blocked bile ducts, itchy skins, low level of fat-soluble vitamins in the body, bile duct infection, and cirrhosis. Nutrition for primary sclerosing cholangitis, patients should eat well-balanced meals that provide enough calories and nutrients. Recommended eating of foods that are high in vitamins A, D, E, and K, the fat-soluble vitamins. Should avoid eating raw shellfish such as oyster, which can have bacteria that may cause severe infection in people with liver disease. Avoid foods that are high in salt, fat, and carbohydrates, especially those with added sugar. Stop drinking alcohol, especially if patient has a primary sclerosing cholangitis and cirrhosis. المحور الرابع من هذه الوحدة hemochromatosis. Hemochromatosis is the most common form of iron overload disease. هو مرض ناتج عن تراكم عنصر الحديد. Iron is important because it's part of hemoglobin, a molecule in the blood that transports oxygen from the lungs to all body tissue. However, too much iron in the body leads to iron overload, a buildup of extra iron that without treatment can damage organs such as liver, heart, and pancreas, endocrine glands, and joints. إذن قد يؤدي تراكم الحديد إلى تلف في الأعضاء الحيوية. يوجد 3 أنواع من الهيموكروماتوسيس. الأول يسمى برايمري أو هيريديتري، سكندري، والأخير يسمى نيونيتال هيموكروماتوسيس. Risk factors of hemochromatosis. يرتبط ظهور المرض بجينات خاصة أكثر ارتباطا مع العرق القوقازي. Both men and women can inherit the gene defects for hemochromatosis. However, not all will develop the symptoms of hemochromatosis. بمعنى ليس الجميع سوف تظهر لديهم الأعراض. Men usually develop symptoms at younger age than women. Women lose blood which contain iron regularly during menstruation. Therefore, women with the gene defect that cause hemochromatosis may not develop iron overload and related symptoms and complications until after menopause. Symptoms of hemochromatosis. A person with hemochromatosis may notice one or more of the following symptoms: joint pain, fatigue or feeling tired, unexplained weight loss, abnormal bronze or gray skin color, abdominal pain, loss of sex drive. Not everyone with hemochromatosis will develop these symptoms. Complications of hemochromatosis. المضاعفات التي تنشأ نتيجة الهيموكروماتوسيس. Without treatment, iron may build up in the organ and cause complications including cirrhosis or scarring of liver tissue, diabetes, irregular heart rhythm, arthritis, erectile dysfunction. The complication most often associated with hemochromatosis is liver damage. أكثر الأعضاء تؤثرا هو الكبد. Iron buildup in the liver causes cirrhosis, which increases the chance of developing liver cancer. ممكن أن تزيد احتمالية حدوث liver cancer. For some people, complications may be the first sign of hemochromatosis. However, not everyone with hemochromatosis will develop the complications. Treatment of hemochromatosis. Hemochromatosis treated by phlebotomy, drawing blood. يعالج بسحب الدم. بناء على شدة المرض ونسبة الزيادة في الحديد يمكن سحب نصف لتر من الدم مرة أو مرتين أسبوعيا لعدة أشهر أو طول السنة. يجب أن يتم قياس مستويات الفيريتين بشكل دوري. يجب أن تكون نسبة الفيريتين في الدم ما بين 25 إلى 50 مايكروغرام لكل لتر. في بعض الأحيان قد يحتاج المريض سحب الدم كل عدة أشهر. Nutrition for hemochromatosis. Iron is an essential nutrient found in many foods. People with hemochromatosis absorb much more iron from foods they eat compared with healthy people. الأفراد الذين لديهم هذا المرض لديهم قدرة على امتصاص كمية أكبر من الحديد مقارنة بالأصحاء. People with hemochromatosis can help prevent iron overload by eating only moderate amount of iron-rich foods such as red meat and organ meats, avoiding supplements that contain iron, avoiding supplements that contain vitamin C, which increases iron absorption. People with hemochromatosis can take steps to help prevent liver damage, including limiting the amount of alcoholic beverage they drink because alcohol increases their chance of cirrhosis and liver cancer, avoiding alcoholic beverage entirely if they already have cirrhosis. المحور الخامس والأخير من هذه الوحدة Wilson disease. Wilson disease is a genetic disease that prevents the body from removing extra copper. The body needs a small amount of copper from food to stay healthy. However, too much copper is poisonous. Normally, the liver filters extra copper and releases it into bile. هي عدم قدرة الجسم من التخلص من كمية النحاس الزائدة والتي تصبح سامة في الجسم نتيجة عدم التخلص منه من خلال العصارة الصفراء. In Wilson disease, the liver does not filter copper correctly and copper builds up in the liver, brain, eyes, and other organs. Over time, high copper level can cause life-threatening organ damage. Nature of Wilson disease: an inherited autosomal recessive mutation or a change in a specific gene. Symptoms usually appear between ages 5 to 35. Symptoms include liver-related signs and symptoms, central nervous systems-related signs and symptoms, mental health-related signs and symptoms. المؤشرات والظواهر لمرض ويلسون تشمل الكبد، الجهاز العصبي المركزي، وأعراض متعلقة بالصحة العقلية. Case reflection rings. Case reflection rings result from a buildup of copper in the eyes and are the most unique sign of Wilson disease. A rusty brown ring around the edge of the iris and in the rim of the cornea. هي حلقة بنية حول حافة القزحية وفي حافة القرنية، وهي أكثر الظواهر المميزة لتراكم النحاس في الجسم. Complications of Wilson disease. People who have Wilson disease that is not treated or diagnosed early can have serious complications such as cirrhosis, kidney damage, persistent nervous system problem, liver cancer, liver failure, or death if not treated. Medications. الأدوية المستعملة في معالجة Wilson disease من خلال chelating agent. هي عبارة عن أدوية ومركبات كيميائية تستطيع أن ترتبط مع النحاس لتكوين مركب معقد. هذا المركب يستطيع الجسم أن يتخلص منه وهو يحمل النحاس الزائد من الجسم. Chelating agents are medications that remove extra copper from the body by releasing it from organs into the bloodstream. Once the copper is in the bloodstream, the kidney then filters the copper and passes it into the urine. Chelating agent recommended at the beginning of the treatment. A potential side effect of chelating agent is that nervous system symptoms and become worse during treatment. The two medications available for this treatment include tritiline and dibencylamine. Changes in eating, diet, and nutrition. People with Wilson disease should reduce their dietary copper intake by avoiding foods that are high in copper such as shellfish, liver, mushrooms, nuts, or chocolates. هذه الأغذية غنية جدا بمصادر النحاس، لذا يجب تجنبها قدر الإمكان بالإضافة للعلاجات اللازمة وهي chelating agent مثل البنسلامين. يجب تقليل شرب المياه من الحنفية النحاسية نظرا لما قد تحمله من رواسب النحاس. People with Wilson disease should not use copper containers or cookware to store or prepare foods or drinks. Regarding zinc, zinc will be prescribed for patients who do not have symptoms or after a person has completed successful treatment using a chelating agent and symptoms being to improve. Zinc taken by mouth as zinc salt such as zinc acetate blocks the digestive tract's absorption of copper from food. ما يحدث هو أن الزنك يمنع امتصاص النحاس من خلال جدار الجهاز الهضمي. يمكن استعمال الزنك للحالات التي ليس لديها أعراض أو أنها تحسنت بعد تناول chelating agent. Maintenance or long-term treatment begins when symptoms improve and tests show that copper is at safe level. Maintenance treatment typically includes taking zinc or a lower dose of chelating agent. A treatment for people with Wilson disease who have no symptoms may include a chelating agent or zinc in order to prevent symptoms from developing and stop or slow disease progression. يساعد إعطاء الزنك أو الشيليتنج ايجنت المرضى الذين لا تظهر عليهم الأعراض من تقدم ومن سوء المرض. إلى هنا نصل إلى نهاية هذه الوحدة. شكرا لكم وشكرا لاستماعكم، والسلام عليكم ورحمة الله وبركاته.